Okay. Okay. So today for FND Awareness Day, I've got 3 young people who are here to share their journey with FND. So perhaps you guys can introduce yourselves. I'll go alphabetically. So Charlotte, do you want to introduce yourself?
Sure. My name's Charlotte. I'm 16 years old and I was diagnosed with FND in June 2021 when I became suddenly paralysed after being really unwell for many years with lots of different symptoms. Something about me, I've danced my whole life and I also love to play rugby, and I'm hoping to get back to both of them soon.
Awesome. I hope you do too. All right, Jazz.
Hi, I'm Jazz. I'm 15. I was diagnosed in February 2020 with FND. Looking back at my past medical health, we could see that I've had it for quite a few years. One thing about me is I love to socialize and hang out with my dogs. And yeah, that's me.
Awesome. All right, and Rosie.
Hi, I'm Lily Rose, but I love to be called Rosie. I got diagnosed with FND in June 2020, but again, looking back on my past, I've had it for quite a while. I've danced my whole life and I love to crochet and I love Billie Eilish.
Awesome. So I've got a couple of dancers here. All right. So as a young person living with FND, there are a lot of challenges. A lot of people struggle going through your teenage years, and going through your teenage years living with COVID has been a big challenge, but you guys have been going through all of this plus living with FND. So how has FND affected you? So Charlotte, do you want to share?
I think FND has affected me when I had like times in hospital or I was missing school. I always felt like I was missing out on like the normal teenage things, and I think that took a big toll on me. Yeah.
Impacted your schooling when you're in hospital?
Yeah, and my social life as well, because I wasn't being able to see my friends as much as I usually would.
Yeah, and I assume you had to stop your dancing and your rugby?
Yeah, I had to stop dancing and rugby.
Okay. Yeah. All right. And what about you, Jazz? How's it affected you?
One major thing it's affected me is my schooling. Yeah. I was diagnosed when I was in year 9, but I was sick all of year 8. I had to leave mainstream school and do distance education. So I have lost all the interaction with friends and family, like friends and teachers, and the one-on-one help with teachers. Mm-hmm. So it is definitely impacted me like that.
Mm-hmm. Okay. And with distance ed, do you have interactions with teachers online, or is it left to you to?
You do Zoom calls in Microsoft Teams, and like you can go into the hub, but I'm doing distance ed because of my FND, so you can't really get into the hub as much as you can.
Yeah.
You really are just kind of stuck at your desk doing what you can when you can.
Yeah, so quite isolating.
Yeah.
Yeah. And what about you, Rosie?
It has affected my schooling and social life quite a lot.
Yeah.
I've managed to, when I have been in hospital stays, when I can, there are hospital schools. Mm-hmm. So the hospital school teachers have been coming up. So I've managed to keep up with the work a little bit, but with my social life, that's been a lot more challenging. Mm-hmm. And then also with like my physical health life, that's changed a lot because I was dancing a lot. Mm-hmm. Yeah. And I had made so many friends through that, and I had to stop it, and yeah, that was just a lot on me.
Okay, so you're not doing dancing at all?
No.
Okay, yeah, so you've lost all those social networks. Yeah. Okay, so when you think about your journey now, as a young person with FND, what would you like to have known about before, when you came down? What messages would you have liked to have heard from other young people? What would have been helpful to you?
I think knowing like there is other young people with FND and probably making those connections a bit earlier would have helped me feel less alone, because when I got diagnosed, I'd never heard of it before, and like no one around me had heard of it before. So I thought it was like no one else, and I was just like that rare person that had it.
Yeah, it is isolating. Yeah. We do have a young person's support group, and I know you guys have all connected, but yeah, it is very isolating because you've lost your social networks through school and through your hobbies. So yeah, so connecting with others. What about you, Jazz?
I'd say the biggest message I would wanted to hear is to advocate for yourself.
Yeah.
And not to be dismissed by medical professionals. Stand up for yourself. You're in control of your body. You know your body best. So you say what you want to say and you advocate for yourself.
Yeah.
And always know that it's you. So
Yeah.
you're in control.
Yeah, and that's a hard thing for a young person to do. It's often hard for even adults to advocate for themselves in hospital. So for a young person dealing with this, that can be hard.
It is.
So I guess also in terms of advocating for yourself, having knowledge and information, would that be helpful?
Definitely.
Yeah, yeah, okay.
Having more awareness of FND, so you know about what you've been diagnosed with, so you can advocate and you can know what you're talking about as well.
Yeah, okay, awesome. And what about you, Rosie?
So the same, but like when I was diagnosed, I had no clue. None of my family or friends had any clue what it was. And the doctors who diagnosed me sort of brushed me off a bit and started to not believe me. Like, we know our symptoms, we know our body, and they just started to say, oh no, it's not that, it's not that. So advocating for yourself, as Jazz said, you're in control. You know your body best. And as hard as it is, I did not stand up for myself in the beginning.
Yeah.
I sort of paid for it. So but when you stand up for yourself, it makes a big difference.
Okay. And did it help getting the treatment that you needed?
Yeah.
Okay. All right. Are there any other messages that you'd like to share to other young people?
I have one. I think that like just knowing that everyone's symptoms is different. So get to know your own symptoms and focus on what works best for you. Like some of the information might be helpful to other people, but might not apply to you in some sense. So make sure you learn about yourself. Yeah.
Yeah. And the symptoms are, you know, they're unique to yourself and they are very different. You can have two people with the same label, but with completely different symptoms. Yeah, totally. What about you, Jazz?
Yeah, I was going to say both Charlotte and Rosie have both kind of said the same thing, advocating and knowing your body. Don't push yourself. Like all those kind of same things is what I would love to hear when I was first diagnosed, definitely.
And that one around don't push yourself. Like a lot of people think they have to push their body really hard in physio in order to get better. But with FND, we do have our limits and you need to pace yourself. And it's good to be as active as you can, but without going into that extreme zone where you risk relapse. So pacing yourself is actually really important. And that can be hard to do. And especially when you start to get a bit better, sometimes people push themselves too much and they're like, oh, I'm getting better. And then they push themselves too much and then they relapse. Has that been something that's happened to any of you guys?
Yeah, I've recently just had a relapse. Like I was doing really well, so I started to push myself a little bit more and then kind of went a bit backwards, but now I'm just starting to move forward again. Yeah, and it can be hard to find that, you know, that safe zone for your body, which can also change. You know, some days you can do so much and some days you can't do as much. So knowing your levels and knowing what is right for you on that particular day. Yeah, what about you, Rosie?
So for me, one thing I would have loved to hear when I was it seems impossible in the moment that nothing will change and your life is stuck where you are at that moment, but you don't know what your brain and body are going to do. So symptoms can improve and change even if they're at their worst. Like you never know what your body's going to do on you.
Yeah, and that's, you know, true. Like sometimes when it's really bad, we can get quite hopeless and sort of like, is this going to be my life? And certainly, Jazz, I know with you, the first time I met you, you were in such a bad way. And now, you know, you're up and you're alert and you're talking and doing fantastic stuff.
I actually remember meeting you. Like I was so out of it.
You were almost comatose, like really.
I don't even remember. So that just tells you where you can be compared to where you.
Yeah, like you've just come leaps and bounds, a different person from the moment that I met you.
Yeah.
And that's important that, yeah, symptoms can be bad, but they can also improve. And for a lot of people with FND, it's more like you might be left managing your symptoms, and you might always have to pace yourself and not do too much. Like maybe you're not going to be able to be a professional dancer and do dancing 7 days per week as a career, but you can still gain a quality of life. Yeah. And in terms of you guys, you're all sort of the teenage years, thinking about, you know, I guess you're probably having thoughts around the HSC, high school. Are we going to finish high school? What are we going to do for career? So how has FND impacted any of those thoughts and, you know, feelings around that for you guys?
So I got to my worst point with my FND when I was in year 10, halfway through year 10. So that was kind of the time everyone was getting ready to go transition to year 11 and picking their subjects. So that made me really question, like, oh, am I going to be able to finish school? And I've always wanted to go to uni, so it kind of made me second guess that. But now this year I've started year 11 and I'm going really well so far.
Awesome. Well done.
I'm hoping to still be able to go to uni.
Awesome. So did it, having FND, did that change what your thoughts were about the future and what you might do at uni?
Yeah, I always wanted to be an accountant. I always set my goals really high, and then it kind of made me second guess that. But now I'm learning to not let that thought come into my head and just keep managing it day to day and see how I go.
Okay. So around not being like a perfectionist and having to get the really high marks.
Yeah.
Yeah, I'm a bit like that as well.
Yeah.
So it's adjusting your expectations and being happy with, you know, like if you get through the HSC and you get to uni, that's absolutely brilliant. If you don't, you don't. But you don't have to be number one.
Yeah.
Okay. What about you, Jazz? Has it affected anything?
Yeah, so I've always wanted to be a nurse. And the one major thing with me with FND is the physical component. So if I'm on my feet too long, if I'm using too much strength for too long, that's what kind of sets me back a bit. So being a nurse is obviously going to be a lot of physical components.
It will be.
So I've obviously had to think about different sides of that. But I've always wanted to work in the hospital with pediatrics and in the helping side of things. So I have thought of social work and nursing and all that kind of stuff. But yeah, FND has definitely taken a toll on depending on what I could do in my future.
Yeah. So you're in year 10 now?
Yes, I am.
So you'll be starting to think about subject selection.
Yeah. So because it's all distant, because distance ed is very different to mainstream. So everything runs a whole lot differently. So it's all trying to get everything wrapped around my head and figure out what I want to do in my future as well.
And you'll be staying as distance ed?
We're not quite sure. I'm possibly going to TAFE. It just depends on how my FND goes between here and subject selections.
Okay, all right. And what about you, Rosie?
Yeah, so I was always the highly thought of student who always got good marks and who always put too much pressure on myself.
Yeah.
So it has taken a lot for me to actually be easy on myself and get down from that place.
Yeah.
I always thought I wanted to be a surgeon, like a neurosurgeon. I thought that I was pushing myself to be one of the best, but I realized that's not me, that's not for me. And a more realistic job, I would love to be now a peds ICU nurse.
Okay, awesome. Cool. Yeah, and it's interesting that, you know, you've all sort of mentioned around, I guess, around perfectionism and wanting to do really well. And I do see that a lot, you know, people who push themselves really and work really hard, basically, they're the ones who can kind of put a lot of pressure on their body. So having to adjust those expectations and being okay with that. Yeah. Was there anything else that you guys wanted to share before we wrap up?
I just suppose that you need to make sure you know your body and just keep advocating for yourself. I know that there is hope. When you first get diagnosed, it is a massive shock, but there is people there to support you and you just need to reach out. And that FND, things change every second. So just because you could be paralyzed one day doesn't mean you'll be it your whole life.
Yeah.
So just remember that there is things that can change and you can still get back to where you were.
Yeah, awesome. Very good. Any other messages from Charlotte, Rosie?
I think just finding your right support group and your right friends and making sure your family understands everything, because once you like have that group of people and you know what makes you happy, sometimes like I find if I spend a lot of time with my friends doing things that I can manage with my symptoms, sometimes it distracts me from the
Yeah.
pain and it
Awesome.
makes me feel a bit better.
Yeah, awesome. So finding the right support networks,
Yeah.
and friendship groups. Anything from you, Rosie?
Just put yourself out there with others who have FND, do your research, and inform your family and friends. Like, it doesn't have to be, it's not going to be all you talk about in that, but just so they know in the background what FND is, that sort of stuff, just so they can be prepared and they can support you whenever you need them to.
Yeah, awesome. And they can also advocate for you if you're not in a
Yeah.
position to advocate for yourself.
Definitely.
Yeah, really good advice. Yeah, awesome. Thank you so much for sharing your experiences and your words of wisdom.
Thank you.
Thank you.
Thank you.